Dr. Douglas Coker, PGY4, and I'm here to introduce our speaker this morning. So our speaker today is Dr. Sara Coffey. Our program is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education. Disclosure statement has been signed and is on file in the Graduate Medical Education Office. Dr. Coffey is an assistant clinical professor of psychiatry and behavioral sciences at Oklahoma State University Center for Health Sciences. Dr. Coffey completed her adult psychiatry residency at the University of Chicago and her child and adolescent psychiatry fellowship at Harvard Medical School's Cambridge Health Health Alliance. Sorry. During her adult psychiatry training, Dr. Coffey served as the chair of her public health committee of the American Medical Association's Residence Committee. She served as a public psychiatry fellow for the American Psychiatric Association for 2 years during her psychiatry training. Dr. Coffey has extensive experience working within the public school system in both Cambridge, Massachusetts, and Tulsa area public schools. Dr. Coffey is regionally known as a speaker on the effects of trauma in the classroom and integrated care. Dr. Coffey is currently contracted with the Department of Mental Health to provide technical assistance in the implementation of Oklahoma Health Homes. In this line of work, Dr. Coffey serves as an expert in integrated care models and practices of integration and collaboration between primary care and behavioral health. Through her partnership with the Department of Mental Health, she has provided on-site consultation to the majority of health homes in Oklahoma and has lectured on both collaborative care models in pediatrics as well as preventative care in children. Dr. Coffey serves as a consultant for the Department of Human Services Child Welfare and is a co-lead on OSU CHS's Pediatric Behavioral and Emotional Health Echo. Additionally, Dr. Coffey serves as the Behavioral Health Medical Director for the Oklahoma State University Health Access Network. Please welcome Dr. Sara Coffey.
Good morning. Thank you so much, Dr. Coker, and thank you guys for your patience through that lengthy bio. I appreciate it. It's really a pleasure to be here with you all today. I'm going to get my screen up and going so that we can get started with our presentation. Let's do share screen here. Okay. Again, thank you. Thank you for being here this morning. I'm happy to be here with you all today to talk about resilience in the time of COVID, caring for the caregiver, and a little bit of backstory on this too. So in my child psychiatry training, in the work that I was doing there, I had actually went to medical school to become a child and adolescent psychiatrist. I'm the daughter of a child welfare social worker. And so I had heard so many different stories about children that come from very different walks of life, certainly with a lot of trauma and abuse. For all intents and purposes, when I came to Child and Adolescent Psychiatry Fellowship, I felt like I had the tools to be able to serve in that capacity. And during my time in Child Psychiatry Fellowship, I was also recognizing that I was being impacted by the work that I was doing. Probably not unlike you, it was not uncommon to bear witness to a lot of traumatic experiences that happen to children and to families. And I noticed that I was impacted by this. It wasn't something that was talked about in my training, but as I started to do some research and to understand what was going on, I quickly came to be aware of the risks of vicarious traumatization, recognizing that the work that we do as healers, as physicians, and others in this space can be extremely rewarding, but can also be impactful for our own emotional health. So in my child psychiatry fellowship, just really started on some intentional work around looking at vicarious traumatization, looking at the impacts of the job on the way that we are as humans, as fellow healers, as daughters, sons, moms, dads, and in the community. And so it's really been something that's been a part of my work for, I guess, over about a decade now. I have the great fortune of being able now to be one of the co-leads for our Help for the Healer Echo. And this is also a partnership with the Department of Mental Health through a Healthy Connections grant. Probably not surprisingly, OSU is not the only institution that is looking at the way that the COVID pandemic has impacted our healthcare workforce. Across the nation, there's a lot of really innovative ways that we are giving back to the healthcare community. And I want to extend my gratitude to you all for serving in this really complicated space for the past couple of years. A space that, quite frankly, was complicated even before COVID, but COVID has really shined a light on the need for us to make sure that we are taking care of us, of this space today. And so thank you for joining us in this resilience in the time of COVID, caring for the caregiver. As disclosures, as I mentioned, the Help for the Healer grant in particular is sponsored by the Department of Mental Health and Substance Abuse Services, and we're really excited for their partnership. A plug for our Help for the Healer, we meet every Friday at noon. CME credits are also offered for that as well. And so we would love to have you join, have your fellow faculty, residents, whomever come to join us in our Help for the Healer community. It's a really wonderful space, I think, to be able to bring ourselves to the table in the spirit of self-care. So for today's learning objectives, I want to talk a bit about the social ecological model for self-care. In our last iteration of our Help for the Healer, Jesse Chafin, our wonderful kind of wellness coordinator here at OSU CHS, was part of our hub team. And he and his team brought together this really important framework, I think, for us as physicians to be thinking about whenever we are promoting and maybe getting more intentional about self-care within ourselves as well as within our communities. I also want to review burnout and its consequences in healthcare. I might be preaching to the choir a little bit here. This might be information that is old hat that you guys know, but I do think it's important for us to take a review of it, set some intentionality, and maybe examine our own experience right now so that we can be able to do something about it. We want to recognize the impacts of COVID on the healthcare profession. And again, I know that I'm preaching to the choir here, but I want to offer to you all that if you are experiencing this in some way, that you are likely not alone. In fact, it is not uncommon that we're hearing from our healthcare workforce a lot of the residual effects of dealing with the immediacy of the pandemic. And we want to make sure that we are talking about it so we can provide a space for hope and for healing. And then, as I mentioned, just recognize opportunities for self-care for healthcare workers. If we have some time towards the end of the presentation, we'll also just dive in a little bit to a mindfulness practice invitation. And so certainly if there's something else that would serve you better this morning, by all means, feel free to do that. But I'd love to provide a mindfulness opportunity for you all as well. Okay. So many of you all might be familiar with the social ecological model. And the way that we think about it in self-care is recognizing that it's something that is dynamic and that it is something that can influence each other apart. Quite often, whenever I've been presenting on acts of self-care, the question is always, we're talking so much about the individual, but what about the organization? What about the system that often contributes to burnout, the system that often, perhaps intentionally or unintentionally, contributes to this distress that we're feeling as physicians? And I hear you. I think the social ecological model is a really helpful way to think about a pathway forward to make some change. And what it talks about is that regardless of what is kind of the sphere of influence that we have on self-care, that it all can impact each other. So if you are an administrator or you are somebody that is in public policy or has some additional oversight of your community, it's important to recognize that the systems that you're putting into place, the policy and practices that you're putting into place can certainly impact interpersonal relationships between those that work for you or work with you, as well as the individual. But with that being said, also we see that the individuals kind of experiences their own level of self-care that they're bringing into their daily practice or that they're bringing into the workplace can actually impact interpersonal relationships as well. And I'm sure you all see this. I'm sure that we see this quite often being human. As a psychiatrist, I often see it too. We kind of think that energy can be a little bit contagious as well. But certainly if you have somebody that's bringing that intention into the workplace, that's really valuing the role of self-care, talking with residents, talking with trainees about the importance of taking care of yourself, bringing it into the conversation, that certainly impacts the interpersonal relationship. The hope is that within that interpersonal relationship, the other individual is also valuing and recognizing the importance of filling their cup, so to speak, And what we know is that the more people that we have that are engaging in this type of behavior, this intentional behavior, it can certainly impact organizations as well as the community and public policy. One thing whenever I'm talking with individuals that I want to kind of plant a seed of is that if you're experiencing burnout, if you're experiencing stress for a variety of different reasons in your workplace, it is likely uncommon that somebody else would not be experiencing that. And so if you are somebody that is struggling in some capacity because of workloads, bureaucratic tasks, whatever else is going on, it's highly likely that others in your space are also experiencing that. As Jesse will often say too, that if you're experiencing something, being able to kind of reach out and hear if others are experiencing it can be extremely powerful. And together, collaboratively, you guys can work together to think about a program, think about something that might change the system a bit and bring it forward to leadership. And so I encourage all of us to do this. I think this is something that OSU also as an organization, as an institution, talks about as well. If you see something, say something. If you see a way to improve the work that you're doing to improve patient care, bring it forward. There certainly might be some factors that might limit the way forward that you might intend, but that doesn't mean that others aren't thinking of ways to impact change. And so I will kind of put this in your brain a little bit. When you're thinking about the way that you as an individual might impact the organization, think about bringing in some like-minded folks and never underestimate the power of a small and mighty few to make these really impactful changes. Okay, so let's talk a bit about intentional self-care. And one thing that we talk about on our Help for the Healer Echo every Fridays at noon is really the intentionality of coming together. And like so many of us, myself included, we get so, I think, bogged down in the work. We kind of get into this habit of just doing things over and over. That setting that intentional time to really devote to self-care can be extremely powerful. Quite often I find whenever I am consulting with schools or with other organizations that self-care and wellness programs are often one of the first things to go. Full disclosure, so one of my self-cares is that I do peer supervision with my lovely colleague. And I will tell you, whenever I am scheduling appointments, it is really something that can be easy to change that time. But luckily, I have a really wonderful companion that makes sure that we are meeting quite regularly, that we are setting that intention. And so we might need some help and support from each other to be real intentional about self-care. So when we think about intentional self-care, we're talking about taking time to check in with yourself and to find out what you need. This might be different for all of us. It likely is quite different for all of us. For some of it, it might be phoning a friend. For others, it might be gardening, yoga, golf, whatever it is, making sure that you are setting that intentional time to replenish yourself. In the early days, I would often say that we all have this wonderful, device as a phone that has a calendar on it, and to set that time in there for you. You don't necessarily need to say what it is, but making sure that you are carving out that time for you is really important. We want to prioritize our well-being. And again, I think, if our cups are not full, we are not able to give to each other and to our patients and those that we work with. So really making sure that we are prioritizing our own well-being is essential in the longstanding work that we do. We want to give ourselves time and space to fully engage. There's a lot of quick tricks to be able to do a few mindfulness moments. Taking a few moments out to breathe, but really offering yourself that time to fully disconnect in some ways and to really fully engage in the self-care activity can be extremely powerful. I know this can be really hard for us to do in the work that we do, always being on call, wanting to be there, but really checking in with you and just noticing how that might be impacting your ability to be present can be extremely valuable. And then, as always, reminding yourself to slow down and be present. And some of the work that we've done on Help for the Healer, we've talked about, just even the brief kind of deep breath before you enter a patient room. If you're entering a patient room and kind of washing your hands, maybe doing some box breathing or just counting to 10, just bringing yourself to the present moment. It's not uncommon as physicians and as healers that we're bouncing from one thing to the other. We might have some great goals that are ahead of us. And so our brain might automatically be thinking to the future or perhaps to the past, to the last patient that you saw. It can be really impactful to take a moment to bring yourself to the present moment as you engage in the work. So why is it important? It's extremely important for those of us that are in the helping and healing professions is because we often neglect our own needs. We often talk about the role that we play as physicians. I am a physician. I am a child and adolescent psychiatrist. We are so bound up in the way that we practice and who we are, that being able to kind of take time for ourselves instead of taking time for somebody else can sometimes rub against our core values a bit. And it's important to recognize that. I was listening to a podcast the other day, and they were talking about how instead of saying, I am a family medicine doc, they're going to start saying, I practice family medicine. Oh, and even as saying that, that's something that I recognize a rub of that too. I practice child and adolescent psychiatry. To be honest, that's hard for me to say because I really view myself as a child and adolescent psychiatrist. But sometimes whenever we view ourselves in that whole capacity of being healers, it can be hard for us to set that aside and to really give to ourselves. So maybe the invitation is to practice what that might sound like and to really recognize what that experience is whenever we change the language around what we do and who we are. It's important too because burnout is common among healthcare workers. And we know if we are not kind of replenishing of ourselves, that burnout is going to go up. And so we certainly want to make sure that we are not contributing to our early retirement. I used to joke, I would talk about that I'm going to go sell beads on the beach and how wonderful that might sound. And quite often I feel like I was saying that when I was really burned out because I could not see a pathway forward in medicine that was not allowing me to be true to myself and kind of give of myself. I'm happy to say I don't really have that fantasy of selling beads on the beach. I do miss the beach, but I feel really content in the work that I'm doing now. And that sustainability, I think, can be really impactful. Again, no judgment if you want to go sell beads on the beach. That still sounds like a fabulous way to start a Tuesday morning. And also recognizing the tension between self-care and other care is highly prevalent in our work. Again, if you are experiencing this, you are not alone. It is really hard for those of us that really value and identify with being helpers of others to be able to set aside time and to be able to help ourselves. And so there are some unique differences in the work that we do as physicians and as healers that sets us apart a bit from the general population. So this comes from Medscape Physician Suicide and Burnout Report in 2020. Medscape quite often is doing these burnout reports. This was talking about the generational divide in 2020. And as you can see here, urology was up at the top with about 54% burned out. It really runs the gamut of how burned out our physicians are. This comes from the report in 2020, and we certainly saw some differences. Again, probably not too surprising. I feel like in this conversation, we're often preaching to the choir. But to recognize, I just even think in the title of this Medscape survey, Physician Burnout and Depression Report, Stress, Anxiety, and Anger. Our physician workforce really exhibited and experienced a very, in many instances, a traumatic experience, an overloaded experience that really capped out on the stress capacity. And we're certainly seeing this. In this report, it indicated that emergency medicine physicians, 60% reported feeling burnt out, critical care, 56%, OBGYN, 53%. And honestly, kind of surprising to me, but maybe not, is our public health and prevention medicine still 1 in 4 reporting history of burnout. We often talk about the role that that value plays, kind of being able to work to the top of our license. Certainly, I think the pandemic really pulled in our public health and preventative medicine folks to the top to really have that ability to work very, very hard. But just to acknowledge that burnout is common. It is common among our physician workforce. And really, we have the tools and we have certainly the intellectual capacity as well as willpower, hopefully, to be able to make some changes. And now is the time, I really do think, for us to make some changes in how we practice and to really be able to promote a profession forward that can be sustainable for all of us to be practicing in. So we know too that there's consequences. And again, if I'm kind of putting on my organizational wellness hat and thinking about what administrators and payers want to hear, we should know that there's consequences of burnout. It's not a luxury that we want to take care of ourselves. There are true consequences that impact patient care and medicine's bottom line. We know that there's lower patient satisfaction and care quality whenever burnout is high in organizations. There's higher medical error rates and malpractice risk. So there certainly is a cost to burnout. We know that unfortunately, physician alcohol and drug use and addiction rises whenever burnout is quite high. And so there are real impacts to the soul of being a physician whenever this is occurring. Higher physician and staff turnover, and unfortunately, physician suicide can be a consequence of burnout. And so it's something that I think is impacting all aspects of medical care, including ourselves. And so we certainly want to make sure that we are prioritizing it. When physicians are asked what contributes to burnout, and this remains pretty consistent, I think as long as I've been talking about burnout, we often see that too many bureaucratic tasks, charting, paperwork really ends up in the higher kind of prevalence of physicians attributing to burnout. And so again, something to think about in organizations, whether that be quality improvement or other ways as well. Do we, even though we've been doing this, this is the way we've always done things, do we need to maybe take a look at kind of those administrative burdens and see if there's a way to lessen them to prevent burnout? Other reports was lack of respect from administrators, employees, colleagues, or staff at about 39%. 34% reported too many hours at work, lack of control, autonomy of our own life. And you can kind of see here the other indicators of burnout. So again, I would offer that if you're experiencing burnout, it is likely common that somebody else is experiencing it too. And there might be a variety of factors that we can take a look at to see if we can offer some change to be able to lessen burnout in our population. Important to know too, and again, this stays pretty consistent. It stayed very consistent throughout the COVID literature, looking at burnout, depression, and anxiety, and even pre-pandemic. It was not uncommon that women were experiencing burnout at higher rates than men. And so you can just see this again, women reporting 56% are burnt out compared to 41% of men. So again, being intentional and thinking about this in the organizations and maybe reflecting on ourselves. When we're thinking of coping with burnout, again, this survey was asking physicians, how do physicians cope? And, luckily about 48% were reporting that they cope with exercise. However, 45% were noting that they cope isolating. Several physicians, about 24%, were noting that they cope drinking alcohol. Others binge eating, use of prescription drugs was a bit smaller, but I would offer to you and offer to us that coping really runs the gamut of what we might call more healthy or adaptive coping skills versus those that might not be as healthy or adapting. Isolating is certainly something that we want to think about with our physician colleagues. We know that isolation can be very impactful for not only coping with burnout, but also contributing to depression and anxiety. And so just to maybe take a look at these and thinking about the ways in which you cope. And again, thinking about perhaps more healthy or adapting ways to be able to balance this burnout that, quite frankly, so many of us are experiencing, have experienced, or will experience at some time in the future, just from the nature of the work that we do. When asked physicians about how severe the burnout was, about 54% indicated that it had a strong or severe impact on their life. Again, I think this is something that has really intensified over the course of the COVID pandemic. As you can see here, 22% indicated it had a moderate impact on their life, giving a good majority of those of us working in medicine that were noticing that burnout was really having some significant impacts on our lives. When asked kind of what had physicians done to try to alleviate burnout, I'll tell you, I was very excited to see that about 29% noted that they had participated in meditation or other thought stress reduction techniques. I will offer to you too that part of our Help for the Healer course really takes in some of the mindfulness-based stress reduction principles. Myself and my co-lead are kind of on the pathway to teacher training with MBSR. And for those of us that are very inquisitive and curious and science-driven, important to note that MBSR has a lot of really profound data that supports stress reduction in a variety of different ways. We've invited a few other activities like hypnosis and guided imagery that also has some evidence in the literature too. And so just to invite the invitation, we'd love to see you on Fridays at noon, but you can always engage in this and other activities as well. If you're interested in a mindfulness-based stress reduction, actually the Brown University has been offering many online MBSR programs. I highly recommend that as well, if it's something that you might be interested in looking into. Other physicians noted that they had reduced their work hours to alleviate burnout. They might have changed their work setting. They made workflow changes as well to alleviate burnout. And again, just to offer for you here that there's no one way to kind of move forward in a way to reduce this. Kind of looking at these options and finding a way that might speak to you, that's going to be kind of something that you can incorporate into your own life, can be very impactful. When asked how are we keeping up with our happiness and mental health, 68% noted that they were spending time with friends and family. And I really want us to kind of put this together in the way that people were coping with burnout, with isolating, right? That was also very high. And so we know within our population in particular, that being able to be with friends and family can be extremely helpful in kind of increasing that happiness and mental health. But if we're isolating ourselves, we're kind of removing this coping skill as a way to be able to support ourselves and each other. Luckily, many of our physician colleagues have hobbies and exercise and other ways to support themselves. Again, I think that intentionality is really big. So if you're someone that, love to play tennis or love to golf or love to garden, but you feel like perhaps it's not an intentional space on your calendar, the challenge today would be to be making that more intentional, to be able to give back to yourself and prioritize your well-being. This is another survey that was looking at a year later, examining how the coronavirus pandemic affected the nation's physicians. And again, just to kind of bring it home, you saw more physicians indicating that they felt inappropriate feelings of anger, tearfulness, and anxiety because of COVID, about 57%. And 61% of physicians reported often experiencing feelings of burnout, showing a significant increase since 2018. So, data upon data, survey after survey is showing us that this is the impact of the COVID pandemic. And so we certainly want to make sure that we are seizing on this opportunity to be able to care for ourselves. Quite frankly, after the tremendous amount of care that you all have given to the community over the past 2 years and even before. More than 55% of physicians noted that they knew of a physician who had either considered, attempted, or died by suicide in their career. And 20% knew of a physician who had either considered, attempted, or died by suicide during the COVID pandemic. As a psychiatrist and as a fellow physician and fellow human, I think this number in particular is striking. And it's something that I want to offer to you all as well, that support is out there. It's something that I'm very proud to say that our psychiatric community was noticing as well. One of our guest speakers on Help for the Healer was actually one of the co-founders of the Physician Support Line. And later on in our PowerPoint presentation, I'll give you guys this number as well. It was started during the COVID pandemic. It is run by psychiatrists and really just intended for physicians. We know that unfortunately, it's not uncommon that physicians who are often putting others before them can sometimes be the least likely to seek out support and help. There can be a lot of barriers, including stigma and other factors as well that might prevent us from seeking out that help. This psychiatric physician support line is available for physicians to be able to call into, to be able to receive that support. The co-founders have noted that although it started during the COVID pandemic, it will continue long after the COVID pandemic. And I know that they've had a lot of utilization over the past couple of years. So if you are someone that is struggling, just to acknowledge that help is out there and to recognize that recovery and healing is possible. And we want to make sure that we are supporting each other in this time and space. Okay. So switching a little bit and thinking about the role in which stress plays in burnout and depression and really in the work that we do. Let's talk about stress. So Hans Selye is often thought to be kind of the father of stress theory. And his definition for stress was that it was a non-specific response of the body to any demand. And many that were looking at stress theory felt that perhaps this wasn't as nuanced as it needed to be. Anything can be stress. It's just a demand on the body, whether it be a cognitive stress, an emotional stress, or even a physical stress, thinking about all my bodybuilders out there. But certainly stress is something that we feel just by being human, just by being alive. Perhaps a more nuanced and I think appropriate definition of stress comes from Richard Lazarus, that notes that stress is a particular relationship between a person and the environment that is appraised by the person as taxing or exceeding his or her resources and endangering his or her well-being. I really love Lazarus' definition of stress because it indicates that it's individual, right? My stress might be very different than your stress and vice versa. My stress today might be very different than my stress a year ago, than my stress even tomorrow, based on what else is going on in my personal life or my professional life, how I'm feeling physically. That really that relationship between the individual and the environment is impactful, as well as the way that we are appraising the situation. And certainly we know in psychiatry, thinking about kind of the way that cognition plays a role in how we feel about something. For my psychiatrists that are out there and for my psychiatrist enthusiasts, thinking about Beck's triad of thoughts, emotions, and behaviors. If I am getting ready to start a patient encounter and the thought that goes through my mind is, oh my gosh, this patient is so challenging. They never want any help. They don't even like me whenever I come in there. How's that going to make me feel? Probably pretty crappy, right? I'm going to probably feel pretty hopeless about that patient encounter. My appraisal of the situation can certainly impact my ability to feel well-resourced to go in and to perhaps solve the problem or be there and be of help for another individual. However, if I'm approaching that encounter and let's say I have my trusty resident by my side and I'm explaining to them that I'm having some challenges working through this patient, and my trusty resident tells me, oh, but Dr. Coffey, I've heard that this patient has really struggled with A, B, and C, and have you heard about this new intervention that can be very helpful for them? I actually was talking with this patient last week and I found that they really enjoyed, X, Y, and Z. And so in my mind, that appraisal is, oh, there's a pathway forward. There's some hope for this. And so perhaps my ability to kind of come to the door and to be able to manage what is going on might change a bit. So I do think kind of recognizing that the relationship between the individual and the experience matters, right? My stress is not your stress, is not her stress or his stress. It can all be very different, but also the appraisal matters. The way that we are coming into the situation, the way that we are viewing it can be very impactful. And that is not to say that there are not times where it's just a bum appraisal, right? Like I don't want to sugarcoat anything. I don't want to Pollyanna a situation that quite frankly can be quite crap. That is often where mindfulness can play a role too, that kind of sense of accepting and kind of being there with it. But to acknowledge that there are a lot of factors that go into how we are viewing stress in our daily lives. So this comes from the Center for Studies on Human Stress, and it was something that I found throughout the first iteration of our Help for the Healer ECHO. It's the acronym NUTS, and it's talking about how stress can really be, the kind of predictors of stress can be based on this acronym, that stress often is impacted by something that is novel or new, by something being unpredictable, by a threat to the ego, and a sense of control. And when I came across this acronym and looking at the research around the Center for Studies on Human Stress, I feel like this was so enlightening as a physician. Because if you think about the COVID pandemic that really landed in our healthcare's lap, it was all of these things, right? It was the novel coronavirus, the new coronavirus, a coronavirus that was constantly changing. So the kind of novelty of it was ongoing. It was unpredictable, kind of depending on who was going to be impacted by it, depending on what kind of resources that we were going to have as physicians. It was hard to know what was going to happen. Threat to the ego was also huge. And early on during our Help for the Healer, it was not uncommon that there was a big backlash of the medical community. And certainly we saw, unfortunately, a lot of folks discredit the work that our physician workforce was doing, discredit the amazing work that all of us were doing to really manage and help and heal this community. And that can be very discrediting to us and the work that we do. We come to this profession, we take the Hippocratic Oath, and to have that threat to the ego from the wider community and perhaps not being on board and I think quite often fearful of what was going on certainly impact our overall stress as physicians. And then sense of control. And I know for many of our colleagues, myself included, that sense of control of seeing a problem and knowing how to fix it was challenged quite often. And so I would offer that the stress that you experienced during this pandemic, there's a lot of data and supports to indicate, well, of course it would be stressful, right? Of course it would have impacts, and offer that to say, to normalize it a bit, and to also recognize, when we have some language to kind of understand how we got there, it can be helpful to be able to pull it apart a bit and to be able to move forward in a pathway of healing. So this is another slide that I really like that comes from that Brown Mindfulness Center. And it's another way to think about stress, right? And so they often talk about these zones of experience. And I'm guessing for many of us in healthcare, we often sit in this kind of challenge and learning zone, right? We are lifelong learners in the work that we do. We practice medicine. And so it is not uncommon that we might have all of the kind of knowledge and information coming into a patient encounter, but each patient is different. Each presentation can be a bit different. And so we're constantly challenging and learning. And certainly during the COVID pandemic, this likely bled more into the overwhelm zone. In the challenge and learning zone, it's often a feeling of eustress. It's still a bit of a stress, but it might not be as, I'm going to say, toxic or detrimental to the body and to the mind. It might be a little bit scary, but it also is keeping us engaged, right? We're able to kind of solve a problem, kind of do the best that we can do. We can take baby steps to kind of get something done. And this can often be a very rewarding space for us as physicians. When we start feeling that we are over our capacity to care, we start entering this kind of blue zone or this overwhelm zone. And this is really kind of this sense of feeling very panic and stressed. This is when our cup is not full and we need to think about pushing ourselves back, perhaps into the comfort zone. Important to know too that although many of us like to live in this challenge and learning zone, it might not be sustainable. And we likely need to kind of come back into the center and feeling nourished, recharged, and resourced in this comfort and resource zone. But also too, living in this zone in particular all the time might not be the best way for growth. And so it's a dynamic thing, right? And I would offer to you too, I'm sure you all know this, that the way that you feel is dynamic. Day to day, moment to moment, and to really be checking in with kind of what you need. The checked out zone kind of in the middle here, I worry that this is many of our physician colleagues that are kind of isolating the sense that even being able to be resourced and renourished and restored feels overwhelming. And so we're kind of going into this checked out zone. The way that the educators at Brown Mindfulness Center will talk about is that this is kind of more like a donut. And so rather than being a two-dimensional thing, it's a three-dimensional aspect where the overwhelm zone can even kind of come into the checked out zone. And so, full disclosure, we know that sometimes we're going to be overwhelmed. We know that sometimes we're going to be checked out, but maybe using this visual to kind of think about where you are in relation to the work that you're doing at home with your family or out with your friends and colleagues, to really be able to offer a sense of replenishing yourself and giving you what you need. Okay, so let's talk about fight, flight, freeze, tend, and befriend. If we were in person, I would ask you guys to raise your hand and tell me who has heard of fight, flight, freeze, maybe even fight or flight, maybe freeze is still a little new too. And I'm assuming many of you would understand this, right? We understand the parasympathetic and the sympathetic response to fear, that it is a very adapted kind of technology that we have within our body that has kept us alive for decades. That if I am getting ready to cross a busy road, to go across the street, and all of a sudden out of nowhere, I see a car zooming by, I don't want my very calm, sympathetic kind of planning oriented mind to be taking the time to think about what am I going to do next, right? I want that fight or flight mode to come right into gear. I want my muscles to receive all of the blood, my hearts and lungs to be pumping blood very, very quickly, my eyes to be dilated so I can sense danger, to pop myself back up on the street so I don't get hit by the car. It's an adapted function that we have as being human. Unfortunately, we often see this very, very high too under chronic stress. So our bodies have not gotten that great at being able to recognize what is an acute stressor that might be life-threatening to us versus what is a chronic stressor. And so unfortunately, there's a lot of physiological changes that occur under this chronic stress than when we're kind of hyped up, overdrive, fight, flight, freeze. The other way of thinking about that is kind of that yellow zone, perhaps, like we're so overwhelmed that we're just lying there very still. We're playing possum a bit so that nobody can come and to harm us because we are perceived to be, incapacitated. But the other one I want to offer to you too, and this came about in my learning with the help for the healer is this issue of tend and befriend, which is another response to threat that was actually new to me. And I'm fibbing to you. I actually learned about this in the mindfulness course. But it's something that certainly, as a female physician, I recognize that I do quite often. And it's not to say that it's a bad thing. That tending and befriending under periods of stress can be very adapted to species, not only to humans, but also to animals. Like when a threat is occurring, quite often it is the female counterpart, but it certainly can be the male as well. That they are, tending to the others, kind of making sure that we're taking care of them, keeping them safe. But it can also be a way in which we're asserting some control over something that doesn't seem to have any control. And I remember my aha moment with this was recognizing how often I am the first to volunteer, the first to say, oh, I'll do it. The first to, whenever things seems to kind of be getting a little dysregulated, to volunteer to be the leader or the reporter. And quite frankly, I kind of like doing that. But there are certainly sometimes too that I'm doing it out of habit. And a recognition that I had as well is that, there might be something that I am volunteering for that later after the fact, I realize maybe is too much on my plate, too much, maybe overfilling my cup, not in a good way. And so just to be mindful of this too. That's not to say that I want to discourage us from taking care of each other. But when it is in a disservice to ourselves, I think it's something for us to kind of check in on that habitual response. So one way I think about that too is I pause rather than reacting very quickly to an invitation. I might think about it a bit because quite frankly, it might be my own kind of reaction to want to control and be able to do something. And that might not serve me well in the long run. I'm sure you guys have experienced this too. I feel like we're in talk season and I'm very excited to be here on Tuesday morning to talk with you all as well. But it's not uncommon that I'm kind of piling up things in the future that maybe isn't the best for my stress overload. So the invitation perhaps is before we respond immediately, and something that doesn't need an immediate response is to have that quick pause and to really recognize, is this kind of out of habit that I'm doing this? Is it something that's really going to serve me and replenish me? Because it's not uncommon, I think, in our healing profession, and again, certainly among women, that tend and befriend can actually be kind of a reaction to feeling like we need to control, feeling like things are out of control as a way of a bit of a trauma response. Not always, but sometimes. Flight two might also not be all kind of a trauma response, but just checking in, being intentional about the actions that we have, being human. So when we talk about self-care, there's a lot of different ways to do this: physical, social, emotional, and mental. And likely we need a bit of all of this in the service of being human to make sure we're taking care of ourselves. We often talk about self-compassion, and self-compassion is comprised of three main themes: self-kindness, or treating yourself with the same kindness and love you would treat a loved one; acknowledgement of our common humanity; and mindfulness. And so again, mindfulness can play a really important role in being able to adapt these types of intentional efforts as well. When we think about self-kindness, we're thinking about being gentle and non-judgmental with ourselves, especially when suffering. And some really wonderful research that was brought by one of our hub team members, Jen Hartman, was that, it's the self-compassion that really has aided us in being able to be the amazing humans that we are. Quite often we think it's our self-critic. It's kind of, telling us, oh, we could have done better. We should have done more. If I only have done this. But what we really find is that self-compassion is often more of the driving factor in being able to do the amazing work we do. So flipping the script a bit and recognizing the self-compassion can be just as powerful as a motivator than that self-critic might be extremely impactful for the work that we do and the way that we're training our residents to be mindful of the role self-compassion plays in ongoing learning and growing. When we treat ourselves with the same care and consideration of a loved one, again, this is the self-kindness, and we want to make sure that we are providing for ourselves. We want to ask ourselves, what do I need now? I often talk about this as mothering ourselves, right? How do we mother ourselves in a way to be able to give to ourselves? What do you need right now? What do you need to be able to take care of you? Because you are the most important person. And as someone that provides quite a bit of supervision to new physicians as well, we're often talking about this too. Nobody but you knows what you need, right? We're often very good about making assumptions, that other people might know what I need, but we need to be our own strongest advocate and to make sure that others know what we need, because we're the ones that are inside our head and that know ourselves best. So don't hesitate to advocate for yourself. Ask yourself, if a loved one was suffering in this way, how would I respond? So again, that kind of puts us in this notion of being the care of the other, right? It can be very challenging for us as physicians to care for ourselves whenever we're caring for others. Well, what if you were the other? What if you come to the table and are looking at yourself and are recognizing that you too are of value and needing the same support and care that you would give somebody else? This common humanity theme is also really impactful too, and it kind of ties back into the survey data, right, from Medscape, thinking about isolation, that really connectedness rather than separation or isolation can be extremely powerful. So, shame can often play a role here. We could often want to retreat. I too know when we think about vicarious traumatization that shame is a big factor in not acknowledging that we might be experiencing something like this. As I mentioned in the preview, I went to medical school to be a child and adolescent psychiatrist. I'm the daughter of a social worker. I've heard these stories forever. There's no way I should be impacted by this. Well, I was. And again, important us to put that down and to make sure that we can take care of ourselves to be able to be of service to others and also to ourselves. Kristen Neff notes that when we feel that we are alone in our suffering, it can distort our reality and exacerbate our suffering. So again, isolation can be tricky, right? We're kind of alone in our own thoughts, and that kind of Beck's triad of thoughts, feelings, and behaviors can really get ramped up there. And so we want to make sure that we're checking in. And also realizing that suffering and personal failures are shared with others. It can be really impactful for lessening the self-blame. We know that it is not uncommon in the world of medicine that we are dealing with a million variables, right? And so it's not uncommon that we're always learning and that we might often have opportunities where things didn't go the way that we intended. That is not unique to medicine. It's not unique to being human, but certainly I think the impact that it has on us as physicians and healings can be very impactful. And we want to make sure that we are sharing within those stories so that we don't feel alone. As I mentioned, and I feel like this is not that this is an infomercial for mindfulness, but maybe it is, because mindfulness can be very impactful. Mindfulness can be very helpful. And the lovely thing about it is that it's something that is free. It can take some time, certainly, but it does have a lot of powerful benefits to, let's say, kind of lessen a lot of the ailments that we experience in being human. Jon Kabat-Zinn defines mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And if you come to our Help for the Healer, you will often hear this definition. It's the definition that we use in our mindfulness practice. And we note that mindfulness and self-compassion asks us to become aware of our negative thoughts and feelings, and not to deny them or fight them, but rather just to be with them as they are. Again, there's a lot of ways to kind of approach our psychology, positive psychology, kind of spinning things as well. Mindfulness kind of allows us to sit with them. And quite frankly, I think in the past couple of years, it's not helpful to have a positive spin. Things have been really challenging. And to be able to tune in, tolerate, and sustain and kind of sit with that can be very powerful in the way that we can be able to be with ourselves in this way. We also know too, when we fail, we tend to focus on the failure itself rather than the feeling of pain, which can be a way to kind of over-identify. And again, I feel like I keep talking about my supervision, but if you don't have a peer supervision, I highly recommend it. But I know that's one thing that my peer supervisor often does too, is when I'm talking about a way in which things didn't go my way or something went bad, to be able to pull back and to really acknowledge how it felt can be extremely powerful, because we're very quick to kind of push that aside. But we know that we are human, and we know that we are impacted by the work that we do. And we know that within that uncomfortableness can often be quite a bit of growth. So this comes from a quote from Dr. Olivia Ong, and I'll just read this for you. That doctors can practice self-compassion by acknowledging their suffering with burnout, connecting with people around them and themselves by asking for help when close to burnout or when they are already there. And most importantly, they accept themselves for their imperfections and being kind to themselves. The sooner doctors can learn self-compassion, the sooner they can heal themselves. I want to say that last sentence again. The sooner the doctors can learn self-compassion, the sooner they can heal themselves. And so again, the invitation is to extend that compassion that you have for all of the patients and all that you serve, and reflecting that back on yourself, because it is important, and it should be prioritized. And you are worthy of that. And also with that too, it aids in the work that you continue to do, as a physician, as a healer, and really as a pillar of the community that you guys are involved with. When we think about some self-compassion misconceptions, there are some, and maybe too, as we're going through this conversation, you're having some of these come up. The misconception that it's selfish, that it's another form of self-pity, that it's weak or cowardly or passive, that it will lead to self-indulgence, and that it will undermine or sabotage motivation. Again, as I mentioned, what we find is quite actually the opposite, that with that self-compassion allows greater growth, and that kind of self-critic that maybe sits on this corner and tells you should have done things better, is actually the one that's pulling us back. So we often talk about in our Help for the Healer that you are the scientist, you are the experimenter. So to give it a try and just to notice what it's like for you, right? To have that intentionality and see if you appreciate a difference. Maybe you will, maybe you won't, I don't know. Come to Help for the Healer and let us know what it was like for you to really invest in the self-compassion language and intentionality that we do. Some tips to practice is to comfort yourself physically, give yourself a hug. You guys aren't on screen, but I am, and I'm going to give myself a hug, and you can do this right now. I feel like I can't tell you how many different Zoom calls we had where we were hugging each other. It feels quite good. So giving yourself a hug, kind of being there for yourself physically, be aware about how you talk about yourself. Full disclosure, I do this too, but to check in whenever you're talking about you did it wrong, you could have done it better. Thoughts matter. And so maybe checking in and being more intentional about that. And list in some positive self-affirmations and that kind of growth mindset. Ask yourself how you would treat a loved one that was coming to you in that way. Meditate, mindfulness can be very important. And then also noting that difficult emotions may arise. And in this moment, we can embrace ourselves with kindness and care and response. And remembering that imperfection is part of the shared human experience. I have yet to find somebody who is perfect. If we do, we should write a big case report from OSU, but I just don't think it's possible. We're not growing if we're not trying things new, if we're not messing up. Luckily, in this kind of spirit of academia, we have additional supports to make sure that we're doing okay. In that imperfection and that comfortableness is growth. And so if we're not messing up, then maybe we're not growing. As I mentioned, I want to make sure to give you guys the physician support line. This is here. As I said, it's psychiatrists helping U.S. physician colleagues 7 days a week, 8 a.m. till 1 a.m. Eastern time, free and confidential, no appointment necessary. So if you find yourself that you're someone that is struggling, please note that this resource is available to you. If you want to, on our box.com account, you can see the lecture that was given by the co-founder of this, and certainly invite you to take a look at all of our activities that we have on our Help for the Healer. We have several didactic presentations as well as some mindfulness activities too that you might want to try. Okay. So with that, it's 7:53. What I'd like to do before we go into questions is just take a moment to practice a mindfulness exercise. And what I'm going to do is I'm going to stop my video as well. And this is an invitation. And so if you choose not to accept it, it won't hurt my feelings. But if you'd like to join this little virtual community in a mindfulness exercise, you might wish to gently close the eyes or soften the gaze. If you're seated, you might just find yourself noticing the pressure of your feet on the floor or the sit bones on the seat. You might just take a big deep breath in and then let it out. And then just come to the breathing, gently letting the shoulders fall down the back, perhaps raising the crown of the head to the ceiling, gently tilting the chin. Maybe just noticing the breath here. There's no need to control the breathing. Just simply to notice the breath. Perhaps you notice the breath on the inhale coming through the nostrils, sliding down the back of the throat, expanding the lungs and abdomen. Perhaps just checking in where the breath is felt the strongest. And just simply breathing. Just simply being here. As thoughts enter your mind of activities you're coming from or the to-do list ahead of you, just gently and firmly bring your attention back to your breath. Breathing in and breathing out. Breath in and breath out. A reminder that each time you bring your attention back to the breath, that is a moment of mindfulness. Coming again and again to this moment, to this breath. Breath in and breath out. You may choose to follow a single breath through the inhale and the exhale, and then catching the next one as it enters the body, and as the moment it turns to an exhalation. Breathing in and breathing out. In a moment, as we transition from this formal mindfulness mini practice, just notice how the breathing changes. Perhaps notice any sensations in the body. You might introduce some gentle movement into the fingers and toes. Maybe just gently open your eyes and take in the room around you. Come back to the virtual space if you wish to. A reminder that throughout your day that is always available to you. Before you enter a patient's room, before you close your eyes for sleep, before you transition to your home. We have a few minutes left that I'd be happy to answer any questions as we come back to this virtual space. And again, thank you guys so much for your time today. I know your time is valuable. I'm glad that you are here. Hope you guys have a wonderful rest of your week. Join us on Fridays at noon.
Thank you, Dr. Coffey. That was great.
Thanks, Heather. I'm sticking around, but I'm happy to sign off if you guys have